Hello guys, so yesterday I posted a video on neonatal jaundice and someone in comment section asked about what is physiological jaundice and what is pathological jaundice and which one is dangerous. So I thought I should make a detailed video on the explanation. So, so first of all, what is jaundice? So jaundice is nothing but the yellowish discoloration of the skin. So if the baby develops yellowish discoloration, that is known as jaundice. Now there are two types of jaundice in neonates. There is physiological jaundice and there is pathological one. So first of all, we will discuss about the physiological jaundice and then about the pathological one. So in physiological jaundice, there is no danger for the baby because every neonate will develop the physiological jaundice. Either he or she will be term or preterm. So physiological jaundice is transient for a short time and mainly there is unconjugated hyperbilirubinemia seen in healthy term or near term newborn. Now the causes, so there is increased bilirubin production because the baby has high RBC's mass and high RBC's turnover, which will when RBC break down, they will break and release the hemoglobin, and hemoglobin will turn into the biliverdin and bilirubin that gives color, yellow color to the skin. Next cause is immature liver. So neonates has immature liver, and that will lead to decrease conjugation and excretion of bilirubin. So there's increased production and decreased excretion. They will lead to buildup of bilirubin in blood, and which gives color to the skin, which is yellow color. Say. In other cases, there is breastfeeding jaundice. In breastfeeding jaundice, there is inadequate intake of the breast milk, so the baby develops jaundice. And next is breast milk jaundice. So there are some substance in the breast milk, like some enzymes which decrease the breakdown of bilirubin, which decrease the conjugation of bilirubin, and that leads to decreased excretion of the bilirubin. Now the features which help us to differentiate between the physiological and pathological jaundice. So physiological jaundice appears after 24 hours of life. Okay, and it peaks on the third and fifth day. If we talk about the total serum bilirubin level, so it is usually below the 12 to 15 milligram per deciliter in term baby and about equal or less than 15 milligram per deciliter in preterm baby. And mainly it is unconjugated or indirected bilirubin. And the baby is usually healthy. There's no signs of CNS irritability, vomiting, lack of feeding, and lethargy, and there is no hemolysis or underlying disease. And it resolved by the 7 to 10 days in term and by 14 days in preterm. So it usually resolved by itself. There's no need of treatment. Okay, but if we talk about if there is high level of bilirubin, so we could suggest the parents to show the